Hello again everybody, Jeremy Latham, the hip surgeon here. I'm going to talk today again about choosing a surgeon. This is really on the background of what's going on in the world at the moment, which is unsettling for everybody. We have the coronavirus pandemic, which is spreading like wildfire. Lots more new cases today. Hopefully the mortality rates will be quite low, but we just don't know at the moment. We don't have enough information about it. We've also had the publication of the inquiry into the Patterson affair. Patterson was a surgeon in the West Midlands who operated on thousands of patients doing unnecessary procedures and was put in prison for 20 years. That's going to have a big impact on how we practice surgery and medicine going forward, particularly as the recommendations say there must be much tighter control of information going between the private and the public health sectors. In addition to this, we've also got the scandal in East Kent Hospital where there have been a number of perinatal deaths, and there's calls for a public inquiry about that. So lots of really quite unsettling news in healthcare, both globally and here in the UK. So I thought that might be a good moment to talk about how to choose a surgeon. This was really triggered by a conversation I had with a patient last week, one of my hip replacement patients. She showed me an article in the Oldie, a very popular publication in the UK, written by a brilliant writer called Theodore Dalrymple. He was a GP who worked in the prison service, amongst other things, and wrote some very insightful articles for The Spectator on his experience of working in a very challenging environment like the prison service. Dalrymple made the point that in order to have good surgical outcomes, we need a very high standard of surgical training and experience, and we do have that in this country. Surgeons are very tightly regulated. We have to undergo annual appraisal, and every 5 years we have to be revalidated in order to have a license to practice like other doctors. But clearly the system has gone astray somewhere because people like Patterson have been allowed to carry on their practices, hiding in plain sight. Now, if you speak to any surgeon, he or she will know that there are rogue surgeons everywhere, and the trick is to try and avoid those surgeons if you're planning to have surgery. So how do you go about choosing a surgeon? Well, obviously I want you to choose me to do your hip replacement. I'm a hip surgeon. I've been a hip surgeon for over 20 years. I've done over 4,500 hip replacements, revision surgery and hip resurfacing. I know exactly who I'd go to if I wanted a hip replacement because I'm in the healthcare network, and within a couple of phone calls I could know who the go-to person is anywhere in the UK and probably in the world for any type of procedure or treatment. Most people don't have access to that information. So how do you choose your surgeon? Well, there are various things you can do. Speak to friends, relatives, people at work, people you know who may have had the same condition as you. Ask them who their surgeon was, where they were treated. How did that surgeon treat them? Did he communicate well with them? Was he a nice person, or he or she a nice person? How do they interact with their team of managers, nurses and other staff? Often a good surgeon will have a very good network of people like anaesthetists, nurses, physiotherapists, and get on well with the management. They want to provide the best service they can, which is safe, effective and timely. That's what most of us want to do. Some surgeons don't have those values. They're the ones to avoid. Look at the National Joint Registry website. There's some very good information on there about hospitals and individual surgeons, how many operations they do, what their mortality rates are, and what sort of implants they use. Lots of people use social media, Google, and looking at surgeons' websites. These, of course, can be quite misleading. Just because someone's got a good website and puts out lots of social media content doesn't mean they're any good as a surgeon. You have to look beyond that. So use all of these bits of information to help you make a decision. If you're going to have treatment in the NHS, clearly you can't choose the surgeon who operates on you. But you can get information about that hospital, what their success rates are, and who their surgeons are. So that's a good starting point. And rest assured, if you are having NHS treatment, most surgeons are well trained and committed to getting a good outcome for you. I hope this information has been helpful for you. If you've got any questions or comments, please do get in touch. The details will follow after this. I hope you like these videos. If you do, please hit the like button. If you like my channel, please do subscribe to it. I'll be putting more content out there over the next few weeks. Thanks again for watching. I'm Jeremy Latham. I'm the hip surgeon.